And question number one, it's a two-part one. It says, what about marijuana and tobacco? And the speaker says that they have PTSD and use marijuana nightly for the last 8 years on doctor's orders. So could you comment on marijuana versus tobacco?
Okay, so we know that tobacco is an irritant, even marijuana, if the method of ingestion is smoking it, it comes with other particulates that probably isn't very good for your lungs. Same with vaping. The edibles might be okay. I think that the literature for marijuana is emerging. It depends on where you are in that PTSD and your arousal cycle and how fragmented your sleep is and what's going on. It's a complicated answer. It may well help sleep and it may help you function as a person, but there is more. If I were to direct you in terms of the PTSD to get to the root cause, I would direct you to the work of Dr. Joe Dispenza. He wrote a book called You Are the Placebo and Becoming Supernatural. The idea about quantum physics is that we're all particle and wave. And, you know, instead of managing the particle, if we could align with the wave, then the particle doesn't need to be managed in the same way. I might be butchering the premise of what he says, but going back to your question, you can reach out to me privately if you like. It's a complicated question for what you're getting. I'm not sure. It really depends. And if it's worked for you, who am I to come and say it's the wrong thing to do? Might there be a better or another way? Possibly.
Okay, thank you. This is about myofunctional therapy. What is the myofunctional treatment that you recommend, and how much of a role does it play in treatment?
Let me be clear, there was a systematic review. I'll send the report to Bianca and she can put it on the website. In 2015, that showed that myofunctional therapy does work. I'm not a myofunctional therapist, but does it make sense from a scaffolding? If you think about the airway, if you scaffold it a bit better, just principles of physics, an airway that's bigger is less likely to collapse. So is there a way that you could make the airway bigger or more robust? Absolutely, like playing a musical instrument. You know, the didgeridoo, for example, was almost 20 years ago, showed that you can treat mild sleep apnea. If there's a myofunctional therapist, please jump in. This isn't in my bandwidth, but I ask them to assess them to see where the weakness is. I have a horrific tongue tie and I'm working on stuff myself. So part of it is that, like any muscle, for example, if someone is an avid athlete and a bodybuilder, when they stop working out, the muscles don't act the same way and they atrophy. So like anything, if you don't use a muscle, it atrophies. Could you say that about your tongue muscles or your airway muscles or your lung muscles or your biceps or triceps? Absolutely. So how do you optimize their functioning and what do you do about it? Right from birth, it might make a difference. So it might be long-winded. It has been shown to help sleep apnea, but there might even be more to it. The more functional the human is in doing all the things that are naturally aligned with the body, if there's no malocclusion or whatever, and the muscles do what they're supposed to, then maybe you don't need training to do all of that. The question always becomes, is it the deformity, as Dr. Singh has said before, is it the deformity that you're seeing, or is it an underlying genetic problem that is making the person be a mouth breather and have a deformity? Sorry, I can't, it's way too specialized. There are so many airway muscles that I would do them and you a great injustice to tell you what is involved.
Okay, thank you. Now about insomnia. Do you believe in medicines for insomnia?
I do, but under very specific circumstances. My theory and what I told you about how important the airway is, it has become my bandwagon, so much so that the med is not what I address. I address airway function, inflammation, always and persistently, and the environment. I'm a sleep medicine trained doctor. I rarely use hypnotics and treat insomnia. In my mind, insomnia is a symptom, not a diagnosis. So fine, I would certainly give you whatever, but with the caveat that it's a Band-Aid and we got to get to the root cause of what is causing the problem.
Okay, thank you. Next question. Do you have any suggestions for chronic congestion, allergy, post-nasal drip, or chronic sinusitis?
Yeah. Like anything, or Witmans, you want to, if someone was to spill something, a poison or something toxic on their arm or skin, the first thing you do is rinse off. You got to remove and get rid of the environment that has the allergen. So be it the cat or the dog or whatever. Is it going to help in all circumstances? Maybe not. But I don't usually remove the pets, but I get them to work on other things. Airway clearance is really important. Anything like Neilmed sinus rinses to intranasal steroids, postnasal drip, to address that. Sometimes it's even the gut microbiome. For chronic sinusitis, it's to look for GERD or look for comorbid cystic fibrosis or immune dysregulation or other things. Airway clearance is must. I might gross some of you out, but I actually tell people to blow snot rockets in the shower. You got to get rid of the irritant and make the airway patent for it to be functional. That some of the data for airway clearance came from Australia, actually, in people with cystic fibrosis. The ones that had the best lung function were the surfers, because in surfing, you do your own Neilmed sinus rinse. The breath work in that book, Breath by James Nestor, he did an experiment where he put foam earplugs in his nose for 11 days, and he showed how being a mouth breather actually caused him to develop sleep apnea. So now, when I'm tired or I do my own airway clearance, I used to, drink 6 shots of espresso, and now I do breath work for alertness. So when I'm feeling tired, I can send you some biohacks. I do those, and I do breath work for alertness rather than, going to a cup of coffee to help wake me up. I can give you handouts and other things if you want. I just didn't know how detailed you want me to be about that.
I'll let you and Bianca handle that, because this happens every time we have a speaker. And if you're happy to advance it, we'll put it on our website for our members to use. Thank you. Next question regards chiropractic care. Chiropractic care, can it aid in increasing total airway space? Can chiropractors increase airway space?
I'm sorry, I cannot answer that. That is way out of my bandwidth. Can anyone here answer that? I haven't seen any studies that reflect that.
We don't typically have chiropractors as members, but I'll open the floor to anyone to yell in if they have a chiropractor or chiropractic experience for a minute or two. If not, we'll move on. Okay, next question. For a sleep study diagnosis of positional mild OSA, can this be treated with CPAP? Should I repeat that?
Yeah. Positional sleep apnea can certainly benefit from CPAP or a mandibular advancement device. It really depends on what's going on. So I'll give you an example. I have a colleague who has asthma, and in treating her asthma, she was needing to be on steroids every 3 months. The sleep apnea was really mild. The AHI on an HSAT was 5.4, like borderline marginal. I said, you know what? Your asthma is causing you so much grief. You should use CPAP. And after being on CPAP, she uses it nightly. She hasn't been on prednisone in about 6 years. Going back to the positional sleep apnea, non-supine sleep can help. The study shows that. An MAD may even help. The problem with the MAD is if you have a BMI of say 42, 46, there's so much pressure on that jaw and TMJ, and you have to advance it so far that I don't know that that would be enough to counteract the forces of the abdominal contents that push up against the chest and the airway. So yeah, CPAP can help. It's more about, will they use it? In my mind, it's like wearing glasses, right? They have to be the right prescription with the right, provided by the right provider and be administered by the right people to be used appropriately and effectively. But it can help, but other things can as well.
Okay, this is an anecdote to that question from our member saying that he had a patient today with the diagnosis we talked about, positional mild OSA, and the patient presented with a prescription from his sleep physician for an MAD. However, due to the severity of the TMJ related pain, this member advised to either follow his recommendations and lose weight and exercise, or ask for a trial CPAP. So this is the overplay of TMJ pain and the use of an oral appliance.
So I will tell you, I always do a 2-week CPAP trial. Now with COVID, it's a bit harder because, the rules are that it's aerosol generating, so people don't like to use CPAP. I use it because it's just an airway test. If we open the airway, can you feel better? It's a simple question. I just want to know if the answer is yes or no. Because if the CPAP didn't work, then I might be inclined to talk to ENT or look at something else. Because if the airway isn't better, there's more going on than sleep than just the airway. So the problem with this becomes challenging because if the sleep apnea is just annoying enough, this person may not be able to lose weight because the leptin and ghrelin will be screwed up, and they might not be able to exercise because that person feels so terrible. So yes, those are treatment options, but the right thing at the right time matters. So when you think about the sentence, Johnny bit the dog versus the dog bit Johnny, they're very different things. And what you do depends on the right treatment at the right time. So for your person, I would put CPAP for 2 weeks just to see if the TMD pain resolves. I'm going to segue here and tell you about my mom. My mom is 75. She was diagnosed with polymyalgia rheumatica way back in her 40s. She went through the steroid and all these treatments and has had chronic pain for 30 years. Okay, I hadn't seen her because of COVID, and I saw her and she's really barrel chested, and I'm like, what gives? My goodness, something's wrong. So we got a lung test for her, and her lung capacity is only 1 liter. And over time she's been cognitively declining, and we all just laugh and say it's aging because she repeats herself. Please don't quote me because I might tell things that, might anyways. So she's had all this chronic pain. I said, you should go on CPAP. So now she uses CPAP. Her lung capacity was 1 liter. She spent all night hypoxic. Her pain is way better managed. She's off steroids. She uses CPAP nightly. Her sleep quality is better. She can pitch and catch with me like she was in her 40s. She came and looked at my tax return without even doing anything and just look at the assessment. She told me the 4 mistakes the accountant had made. I'm like, oh my God, why did I ask them? I should just ask you to take care of my practice. Like, it makes a difference. I am a product of my own OSA. If you knew me 10 years ago, I was a vile, terrible, rabid, unhappy woman. So grumpy and cranky. I didn't know how well I could think and sleep and feel until I started using CPAP. So we got to try it because we don't know what we don't know. Can you imagine ending up on Canada's worst driver and all you needed were glasses? Think about that. Now after that, I'm like, you know what? Just try. If it's an epic fail, at least we know the answer. That's okay. It's fine. Then we know. If they say, oh my God, his marks are better. He can, one boy, he was in grade 12. He was diagnosed with Klein-Levin syndrome, sleeping 16 hours a day, hibernating bear. I treated his airway, and he used to wear a CPAP. So this is with Klein-Levin, okay? His sleep apnea again was very mild. He used to wear a CPAP after school for fun because he felt so good. He had hypermobility. That would be a talk for another day. In fact, he was so funny. His sense of humor was so amazing. He went from failing grade 12 to passing grade 12 with his marks in the 70, and he's in his fourth year of college. And we would have written him off as Klein Levine and left him to be a sleeping bear for God knows how many years. So the problem is, we don't know what we don't know. Take the blinders off. Just open your eyes and ask questions, please.
Okay, next question. What's the physical connection between active maxillary or mandibular labial frenum and sleep disordered breathing?
Oh, all the smarties in the crowd. I open the floor to let you answer that. This is way beyond my bandwidth.
Okay, so let's do that. So anybody who wants to tackle an answer, turn on your video, raise a hand, and we'll give you the floor. Let me read some of the other comments that came in. I am a myofunctional therapist and use it daily. Excellent. And that's the lady waving to us. Somewhere I saw there's some references to books. 2 chiropractors in Toronto who treat infants in collaboration for tongue tie release. That's good. Looks like a question here, Dr. Witmans. Is there any research on CPAP for asthma?
Yes, there is. So people with severe sleep, severe asthma, people with severe asthma that present at the emergency room every 16 minutes, that have difficulty, there's a 70% chance or likelihood of OSA. So there, I'll have to get you the studies. I don't have them at the tip of my tongue or at my fingertips, but the exacerbations can certainly be treated with CPAP because it's a systemic anti-inflammatory. Basically, what you're doing with CPAP is stabilizing the airway pressures from asthma, because the asthma has a diurnal variability. So there is bronchoconstriction that happens in the night, and CPAP temporizes or splints the airway open and provides airway stability, so the swings in airway pressure wouldn't be so great. I'll pull out the specific references and send them your way. But there's actually, so there are studies, and we are writing a review paper on asthma and sleep apnea, but that one is just focused on children. So we know they're linked, they have common risk factors, but we haven't been able to prove a causative association or a temporal association to say that if you have asthma, you're likely to develop OSA, or if you have OSA, you're likely to develop asthma. But that association has been proven in many studies in adults and peds alike. I can send you the review paper when it's done. It does play a role from a global inflammatory point of view, but typically what happens is each of the studies, they either look at OSA and look at asthma, but they don't look at both at the same time, so it's hard to know.
Hi there, and I see there's a colleague of mine here who is a sleep specialist, and I just kind of dabble, but I got involved because, well, I have 5 kids, and I nursed them all. So I was like pregnant or nursing for 13 years. So I feel, and then now my oldest just graduated, and he's actually in Edmonton doing a GPR. He just graduated dental school. And, you know, comes to mom and he's like, yeah, my jaw's clicking all day and it hurts. And I'm like, you got to do da-da-da-da-da. And he's like, you know, I'm mom. What do I know, right? So he goes off to see Dr. Goodman, Janice Goodman in Toronto. Anyway, so she does a lot of this stuff, and she tells him, yeah, you need X, Y, Z. And well, that wasn't good enough for him. So he tells me, I got a second opinion, mom, from Dr. Goodfellow. And I was like, yeah, that's a third opinion. But long story short, he has sleep apnea at the ripe old age of 26, and didn't learn a thing about it, of course, in dental school, maybe a couple hours, right? And didn't even know enough to figure out how to diagnose himself, right? So eventually he's going to need the expansion, but I'm grateful because, so I came full circle also, because nursing them, you don't put the tongue part together, right? And it was like, I'm doing all these appliances my whole career. I even, like, so I had the 4 on the floor, 1, 2, 3, 4 premolars out and headgear. And so now I have sleep apnea because, you know, past menopause, right? And I wouldn't have gotten the diagnosis either, except because of my learning that I'm doing. So the tongue.
What physical connection between active maxillary or mandibular, labial, frenulum, and sleep disordered breathing?
Okay, so usually when you're talking about like this one here or this one here,
Yeah.
I'm assuming. So sometimes these, because I do the infant frenectomies, and sometimes they're insanely tight. Like you have babies that the parents don't even know that they have a whole lip under there. Okay. And so that alone can cause a lot of tension, right? And they're going to have funny habits where they have like a hyperactive mentalis, right? Or hyperactive also labial, orbicularosaurus. All these things though are going to affect and push things back and restrict their growth of their jaw as they grow. So whenever you do a tongue tie on a baby, you almost always are going to find a lip tie and release it. And the tongue tie, though, I don't think was part of the question, but the tongue tie itself is like huge. I just, once you see it, you can't not see it kind of problem. And I like don't understand how it's legal to even not teach it in dental school anymore. But as far as labial, if that's just the question, that's how I would see it. So I do myofunctional therapy. I suffer from all these things myself, including hypermobile problems as well. So I'm like
Can I
way worse than all my patients.
Yeah. So can I tell you? Yeah, I'm so glad you brought that up. I wasn't gonna mention it, Simi. People that are hypermobile, that lady, the professional woman, she was worse because of her hypermobility. The problem with the hypermobility is you guys are, no offense, please don't take it personally. You guys are like whomping willows. You're like bend and move, and your diagnosis changes. And Simi, you are like the whomping willow. You're so confusing to the poor doctor because they don't know if you're up or down or sideways or all around. Your symptoms are crazy. Sorry. Your symptoms are not boxable. Your suffering is great. It's not measurable. From hypermobile joints to hypermobile gut to hypermobile airway to crazy pain to joints to everything, heart, blood pressure, all of it. I actually had a slide about hypermobile people, and Dr. Height said I should take it out because I might confuse you. But that hypermobility is the elephant who is on speed. It is so confusing. It's interesting. 60 to 70% of my practice is hypermobile patients. And they are even way harder. In fact, Dr. Tui and I have a bunch of hypermobile patients that are complicated to treat because I'm in my bend of them. They've been told they have Lyme disease and they have this thing and this thing. Think of a tree, okay? The root is so messed up that all the leaves are wonky and all the leaves are called different things, POTS, so postural orthotachycardic syndrome, hypermobility, chronic pain, fatigue, borderline personality, blah, 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 blah. It could go on. It could throw the whole ICSD book for you. Chronic fatigue, mast cell activation, chronic depression, fibromyalgia, chronic pain, NYD, PTSD. Good Lord, I could go till tomorrow and it still wouldn't be enough. We're so focused on all the leaves, but we don't look at the root, which is in a hypermobile patient. The whole airway is not supported structurally or functionally in a meaningful way to support the human to function at their best.
So just imagine how amazing I'd be if I wasn't hypermobile. But what I want to say, though, is that I actually don't find it all over the place. I just wanted to share with you, because you say you treat all these patients and have so many of them, so I just got diagnosed by last year, and I'm 55 now. So it was like, oh, this is why I've had all these problems all my life. And what scares me or bothers me or whatever is that how many specialists have I seen over the years, and then they finally go, they don't say anything, and they finally agree with the diagnosis after I'm the one who raised it. And in fact, though, when I look at what you're saying about hypermobility, it's the EDS site from UK has the best information for hypermobility. So I don't know if you're in touch with that, Dr. Witmans, but that's the, like, I don't know anymore where to go. I'm learning about my condition because I don't have a doctor to manage it. And I'm learning about like basically menopause like threw me into like being worse, right?
Yeah, yeah,
Yeah.
yeah.
And I'm
So-
reading about all this sleep stuff, and then I'm trying to manage my clinic. I've got, yeah.
Yeah. So look, you might, okay. So interestingly, I'll send you the papers again. Hypermobility is actually linked to autism. So you are a genius anyway, but you'd be even more genius. Just like me, if I didn't have my grade 4 tongue tie, I might actually have been, you know, tall enough with my compatriots in my family, as opposed to being the midget. Imagine, you know, I too could have been a genius like you. So going back to that, I'll share the papers, but it is even all the endocrine stuff. It is all linked. Adult cystic acne is related to hypermobility, PCOS. You know, I had a 19-year-old who I was following intermittently, and I didn't know about EDS then. And he's 19, and he was diagnosed with schizophrenia, and he had asthma. Oh, the prevalence of asthma and allergies in you guys is 60% compared to 20% in the general population. Same with chronic sinusitis. So inflammation
We got
is.
it all. We're so lucky.
You are lucky, yes.
Okay.
Anyways.
Well, ladies, that was a good exchange. We're getting on in time. So we're coming to the final part of our program where we open the floor for oral questions directly to the speaker. So anyone who has a question that hasn't been addressed tonight, feel free to open your video and raise your hand, and I or Bianca will try to identify you and allow you to speak directly to Dr. Witmans.
Hi, Dr. Witmans. Thank you for your wonderful presentation. And I'm always inspired and just challenged to be more curious. The question I had for you, you've mentioned multiple times comments about inflammatory factors. And I posted a question in the chat box. But the question is, do you have a hierarchy of inflammatory factors that you look at in your diagnosis and treatment of sleep-disturbed breathing?
Oh, I knew you were going to ask that. Dr. Tui and I are meant to connect. He looks so good. He's implemented some of the things. So you know what? I don't have, you know what, the latest thing I'm on to, you know me, I'm a biohacker. As I learn things, I get people to do more and more. The latest thing is called the gut microbiome. So I urge you to read a book called Happy Gut. And his name is Vincent Pedre, and he's an internist, and then he did functional medicine, and he lived with hunting and gathering tribes somewhere, I don't remember where, but for 8 months, and they didn't have any heart disease, any cancer, or any cardiovascular disease. And I don't know if you can see it, but it's called a Happy Gut. I'll send the link to Bianca and information about it. So, it's called a cleansing program to help you lose weight, gain energy, and eliminate pain. And to me, I don't know, Tim, it's so hard. Like, I think about the tree. Okay, can you grow a mango tree in the Arctic? Heck no. Can you grow it in someone's house in the Arctic? Heck yes, maybe. I don't know what to say about the inflammation, because it really depends. Like if we talk about Sim, she has hypermobility. That is florid inflammation. So that might be a little bit of breath work. It might be like a better diet. It might even be mindset. It might even be what we think and believe. If I believe in my wellness, that is worth a lot more than if I believe in my illness. This isn't me saying it, like Eckhart Tolle, all the greats lately, there's a movement about it. So I don't have a hierarchy. I think you all are right. I think that nose breathing is critical based on James Nestor's book. You know, the skin is the first line of defense, and the breath is the second function. And interestingly, when the lungs and the kidneys can't maintain the milieu properly, people automatically get fat. The fat is a response to managing an acidic environment. So then would I encourage someone to eat a hyperalkaline diet, or drink water where the pH is neutral or a little bit more alkaline, do breath work like James Nestor says. So I don't know. To be honest, I use nasal steroids like water. And the longer I do this work, the more I think that I need to get to the root cause. So I say, okay, I'm happy to give you the nasal steroid, but if you don't do the breath work, this is all it's going to be. If you don't do the breath work and clean up your environment and your mindset, it's not going to be any more than that. So even the little kids, I say, you know what? You want your nose to work. It's so important. If you can't breathe through your nose, nothing matters. And you don't even know how good or bad you feel. And I leave them with parting words. Now, the little guys, I say, you know what? This is just stuff. You remember on the inside, you remember your greatness. This is just stuff we're helping you manage in the meantime. But you are already perfect. You came perfect. You've just forgotten some things that make you great. We're just going to help you get back there. I don't know. I don't know what to tell you.
That was very powerful, because we had a mom come in who had been to see you with her children, and she was in tears, describing what you had just said. And when you said that to her boys, and she was in tears describing that. So.
And you know what? I plant a seed. Tim, what I would tell you that I'm here to plant seeds with you. And if I'm so blessed to come back 5 generations from now, I'll say, wow, look at all those trees, man. That's so cool. And for the kids, if my words mean anything to them, I want them to be healthy. I don't want them to get lost in their illness. I don't want them to get lost in their labels or illness. If it serves them, autism, hypermobility, whatever, all the power to you. But greatness is about living your best life. So I plant a seed. So I'm fortunate and blessed to be able to tell you there are some in my practice that with acupuncture and sometimes myofunctional therapy and breath work and mindset, and they're off everything. I say, why are you here? They say, I don't know. I said, I don't know either. I'll see you on some ball field or grocery store somewhere someday. I said, my wish and prayer is by the time I retire, my last breath, everyone will have graduated from my practice as patients and, be star seeds to help others live their best lives, whatever they might be.
My goodness, I think you could be a medical motivational speaker, Dr. Witmans. This is just amazing. It's just amazing. It's getting late, but I don't want to stifle any other options or opportunities. Are there any others in the crowd who would like to address our speaker directly through an oral question? Simply open your video. We'll recognize you and give you a few minutes with Dr. Witmans. And as we wait for that, I don't think we saw any response from folks regarding Vivos particularly. So perhaps we'll just have them go directly to the website for the information that Dr. Witmans alluded to, but didn't feel comfortable in being an expert in that area. So we'll leave that for your own research. And I don't see any other oral questions coming. We've answered all the written ones. So Dr. Witmans, it's been a pleasure to have you back. You did a minor role with Dr. Haight a couple of times last year. We didn't get a chance to really let you present as fully as you did tonight. I'm just so impressed with your presence and your gift to us in more than your medical knowledge. That last little interaction with Tim, I was thinking, oh my goodness, I'd love to be this lady's patient just for the advantage of hearing her speak. So thank you so very much from me personally and from our membership. We really enjoyed your presentation tonight. Okay.
I so appreciate your time. Look, you're doing great work. It doesn't matter who you are and what you do. If you know this already, you're making your difference in the best way you can. And you know what? The people that just do align and without the capacity to think like you, you're going to have a lot of work to correct from their stuff. I'm not trying to be rude or mean. That's not my intent. I wish everybody well, but just keep learning and growing, because it'll take all of us. It'll take every one of us to make the world a better place, no matter what your contribution. Keep going.
Maybe I could finish by reminding our audience what the dean of my school made us memorize upon graduation. And for me, this was many years ago. It was attributed to a Greek educator by the name of Moses Bonamides, and we were required to memorize this as best we could before we left the building. May there never develop in me the notion that my education is complete, but give me strength, leisure, and zeal continually to expand my knowledge. I walked out of that new building in London, Western University, thinking I had the best education because we had the newest equipment and the best teachers. And I was in the military, and within 6 months, I was so frustrated because I found colleagues from all over the country doing things completely different than what I was taught. And I was quite sure they were wrong. And it turns out we all are doing fairly well. And when I addressed the dean many years later as a patient and then friend, a tear came into his eye when he said, "You're the only person to come back to me and say you figured it out." So thank you for keeping us going on that thought process. May there never develop in me or us the notion that our education is complete.